Did you know that according to the Centers of Disease Control and Prevention, heart failure affects about 6.2 million adults yearly in the United States? One of the best places to begin is to learn about the warning indicators to watch for. With that in mind, keep watching to learn about the 10 early indicators of heart failure that doctors and other health professionals want you to be aware of. Do not forget to hit the like and share button, and do subscribe to our channel for more informative and health-related videos. Share this with your friends so they can also be aware of the consequences and the early signs of a heart attack. Now let us dive right into the video.
Subscribe now for future updates, healthy diets, and nutrition news. Thank you.
Number 1. Fatigue. Being too weary, according to Health Harvard, can be indication of cardiac disease. A general feeling of tiredness or fatigue develops in the heart when it can't pump the blood enough oxygen-rich to meet the body's energy needs, says the doctor. Number 2. Pain in the chest. Some form of pain, tightness, or pressure in your chest is one of the most prevalent indicators of heart failure. Charles Chambers, the MD director of the Cardiac Catheterization Laboratory of Penn State, says, "Everyone has different phrase, that feeling. Well, some say it seems like an elephant is sitting there," says one. Others describe that the pain is pinching or burning. Well, Chambers explained, if the symptom is severe or does not go within a few minutes, call 911 immediately, since you may have having a heart attack. Number 3. Nausea and a lack of appetite. Feeling sick to your stomach or queasy may sound like stomach issues, but these are both early indicators of heart failure. Why do they occur? The cause, according to the AHA, is simple. The digestive tract receives less blood, producing digestion issues. Number 4. Heartbeat irregularity. A rapid or irregular heartbeat should never be ignored. When you're excited or frightened, your heart naturally beats quicker. But if the feeling is persistent or appears unexpectedly, it could be a sign you must be worried about. But in most situations, an AHA spokesman told the WebMD, it's caused by something that's easy to correct, like too much of caffeine or not enough sleep. However, it could occasionally indicate a condition known as atrial fibrillation, which requires treatment. Number 5. Breathing problems. Shortness of breath is common after vigorous physical exertion and is totally natural. However, if the symptom occurs more frequently and easily before the other, it may be the cause of concern. If it occurs for you to be passive, such as sitting, lying, or down, you should contact a doctor right away. Shortness of breath with activity or when lying down, according to the Mayo Clinic, is one of the most prevalent indicators of both chronic and acute heart failure. Number 6. Leg, ankle, or foot swelling. Edema is defined by the Cleveland Clinic as swelling produced by fluid trapped in your body's tissues. If you detect inexplicable swelling in your legs, ankles, or feet, you may have edema. Congestive heart failures, but not always as uncommon, is a cause because of your heart lacks the pumping strength to force use blood back up your lower extremities. Number 7. Gaining weight quickly or suddenly. Edema can occur throughout the body, causing sudden unexplained weight gain in addition to fluid buildup in your extremities. According to the Mayo Clinic, being overweight not only puts additional stress on your heart, but it can also be a common cause of cardiac disorders like stroke and heart attack. Number 8. The ability to exercise or to be active is limited. Are you finding it very difficult to exercise and do the physical course that used to be simple, or not going as hard as the gym used to be? Or why you're not sure about? Well, is this the case, you should probably see a doctor, because it could be an indication of a significant health concern. People with heart failures are frequently unable to engage in routine activities because they get easily exhausted and short of breath, where the Harvard Health specialist explained that very easily. Number 9. Confusion or inability to concentrate. Changes in the amounts of certain compounds in the blood, such as salt, might induce the confusion, says the AHA. This can be manifest as a loss of the memory or disorientation, both of which can be detected by a curvaceous or a relative before the patient dies. In any case, there are symptoms of heart failure or other serious medical disorders that should be discussed with the doctor as soon as possible. Number 10. Congestion. Fluid backup in the lungs, in addition to the fluid buildup in the legs, ankles, or feet, is another early indicator of heart failure. According to the Harvard Health researchers, the patients may develop the obvious and prolonged coughing, the wheezing, and the difficulty in the breathing as a result of this. Any of these symptoms should be discussed with your physician as soon as possible. Have a look at these 9 foods that you should avoid to reduce the chances of heart attack. The good news is that by choosing the healthy lifestyle choices in terms of weight, nutrition, alcohol, and cigarette use, and the exercise habits, of course, you can reduce your chances of heart failure. Well, if you have been diagnosed with a heart failure, then there are medications that can help you manage it, although it's very ideal to avoid all of it if best possible. Saturated foods, sugars, and sodium should all be avoided in general. Specific instructions for changing your diet after a heart attack might be obtained from your doctor or a dietitian. Here's a list of food to stay away from a heart attack if you get started. Foods that have been deep fried. One of the most effective ways to reduce another heart attack or stroke after a heart attack is lower your blood cholesterol. Fried meals are high in saturated and trans fat, which can cause high blood cholesterol and plaque accumulation in your arteries. Other processed meats, hot dogs, and sausages. Sodiums and nitrates are abundant in processed meats such as the hot dog, sausage, and lunch meat. This can elevate your blood pressure and increase your chances of having another heart attack. Baked goods that have too much sugar. Sweet sweets should be limited in a heart-healthy diet since they often contain saturated foods and which elevate the blood cholesterol as well as the refined sugar, which spikes blood sugar levels. Nuts and snacks with salted salt. If you want to eat a healthy diet, keep track of where the salt sneaks into your diet. Nuts are high in healthy fats, but avoid the salted ones because they do have a way of increasing your blood pressure that you won't even get to know about. Chocolate in a milky color. If you're trying to improve your diet after a heart attack, dark chocolate is fine, but when you're eating milk chocolate, you must know that you are giving a step ahead to another heart attack. The sugar and fat solids in milk chocolate are higher than in the dark ones. Cream sauces and condiments. Sauces sneaks sugar and fat in your diet, and the salad dressing and the ketchup, for example, may not appear to be sweet, but they do contain a lot of sugar, which can elevate the blood sugar levels. Soda with a lot of sugar in it. Sugary sodas elevate the blood sugar levels and put stress on the arterioles, putting you at a risk of the heart disease. Reduce your soda consumption and drink more water. Red meat. Red meat isn't regarded as a healthy heart food by many specialists. The issue is that red meats are frequently high in saturated food, which can raise cholesterol levels. Alcohol. By boosting your blood pressure and blood sugar, alcohol can put a strain on your arteries. Furthermore, drinking alcohol impairs judgment and leads to poor eating choices that are bad for your heart. Well, hope you have gained all the necessary information that you would need to know in order to reduce the risk of heart attacks and maintain a healthy diet for staying healthy and fit. Let us know in the comment section what your thoughts are about this video. Stay tuned for more informative videos. Until then, eat healthy and stay healthy.